Kidney disease and liver disease, presented by Oakland Community Health Network, an integrated healthcare initiative. This educational PowerPoint is part of the Oakland Community Integrated Healthcare Collaboration Project, which allows for individual organizations to determine staff training needs based on position and job responsibilities, upward movement in terms of skill competency, and coordinated primary care needs of people with severe mental illness or intellectual and developmental disabilities. Some of the individuals we serve may have kidney or liver disease, and this educational PowerPoint is to help team members better understand these diseases. The objectives of this PowerPoint are to provide education and resources for OCHN provider case managers and support coordinators regarding kidney disease and liver disease, to explain the function of the kidneys, kidney disease, and treatment, to discuss how diabetes affects the kidneys, and to explain the function of the liver, stages of liver disease, causes, and treatment. The kidneys are vital organs. They filter waste products from the blood. They are involved in regulating blood pressure, electrolyte balance, and red blood cell production in the body. Most people are born with 2 kidneys, but you can live with only 1. Every 30 minutes, the kidneys filter all the blood in the body, removing waste and excess fluid. Every minute, about 1 liter of blood enters the kidneys through the renal arteries. The blood then runs through tiny filtering units of the kidney called nephrons. Each kidney is made up of approximately 1 million nephrons, and the nephrons either save substances the body needs or they eliminate excess nutrients, water, and waste products as urine. 1 in 3 American adults are currently at risk for developing kidney disease. 26 million American adults have kidney disease, and most don't know it. High blood pressure and diabetes are the 2 leading causes of kidney disease. Kidney disease is the 9th leading cause of death in the United States. And every year, kidney disease kills more people than breast or prostate cancer. Medicare spends $31 billion annually to treat people with kidney failure. In 2013, Medicare expenditures for all stages of kidney disease totaled over $99 billion, not including prescription medications. Men with kidney disease are more likely than women to progress to kidney failure. African Americans, Hispanics, and American Indians are at a higher risk for developing kidney failure, and this risk is because of higher rates of diabetes and high blood pressure in these populations. In 2013, 1,665 people in Michigan reported they had kidney disease. Once the kidneys fail, dialysis or a kidney transplant is required. Every day, 13 people die waiting for a kidney transplant in the United States. More than 661,000 Americans have chronic kidney disease, also known as kidney failure. Of these, 468,000 individuals are on dialysis. Approximately 193,000 individuals live with a functioning kidney transplant. Some risk factors for kidney disease are diabetes, high blood pressure, a family history of kidney failure, ethnicity, such as African Americans, American Indian, and Hispanics have a higher risk, being older than 60 years old, kidney stones, smoking and/or obesity, and having cardiovascular disease. Signs and symptoms of chronic kidney disease. Kidney disease often has no symptoms. It can go undetected until it is very advanced. In its advanced stages, some of the signs of kidney disease include fatigue, weakness, difficult or painful urination, foamy urine, pink, dark urine or blood in the urine, increased need to urinate, puffiness around the eyes, having a swollen face, swollen hands, enlarged abdomen, ankles and or feet, and increased thirst. Diabetes is the leading cause of kidney disease. High blood glucose, also called blood sugar, can damage the blood vessels in the kidneys. Over time, the high levels of sugar in the blood damage the millions of tiny filtering units within each kidney, eventually leading to kidney failure. High blood pressure is the second leading cause of kidney failure in the United States after diabetes. Individuals with early stages of chronic kidney disease are more likely to die from heart disease than to reach end-stage kidney disease. High blood pressure can damage blood vessels in the kidneys, reducing their ability to work properly. The stretching of the blood vessels due to high blood pressure scars and weakens blood vessels throughout the body, including those in the kidneys. Screening for kidney disease involves laboratory tests that are critical. A primary care physician will evaluate a simple blood draw to determine kidney disease by reviewing the following levels: the creatinine, uric acid, BUN, which is blood urea nitrogen, the BUN-creatinine ratio, eGFR, which is the estimated glomerular filtration rate. A urinalysis will also be performed to see if there's protein in the urine. The glomerular filtration rate, which indicates the person's stage of chronic kidney disease, will also be calculated. The GFR factors in age, gender, creatinine level, and ethnicity. Together, the results provide an evaluation of kidney function. In many cases, kidney failure can be prevented or delayed through early detection and proper treatment of underlying diseases such as diabetes and high blood pressure. Progression of kidney disease can be prevented by following a primary health care physician's advice and by attending appointments regularly, adhering to a diet with the right amounts of sodium, fluid, and protein, exercising and avoiding dehydration. If someone is diabetic, it is important to keep blood sugar levels controlled and maintain an A1C level of less than 7, which is an average blood glucose of over the past 3 months of less than 7, and taking medication for high blood pressure as prescribed. Kidney disease stages. There are 5 stages of chronic kidney disease. As the stages increase, the kidney's ability to function decreases as well as the GFR. The next few slides will explain the different stages of kidney disease. Stage 1 to 2. Physical symptoms are few or no physical symptoms that you can feel. Blood work results will show abnormalities, mainly a slightly elevated serum creatinine. By the time serum creatinine is elevated, the person may already have lost 50% of kidney function. Urinalysis will show abnormalities. Treatment for stage 1 to 2 chronic kidney disease may involve some mild dietary changes such as a lower protein diet, and a blood pressure medication may be prescribed. Some people start having high blood pressure in early chronic kidney failure because of damaged blood vessels leading to the kidneys. The diet for stage 1 and 2 chronic kidney failure should include fiber from fresh fruits and vegetables and whole grains such as whole grain bread and high fiber cereal. It's best to limit high-fat dairy products including milk, yogurt, frozen desserts, cream, cheese, and sour cream. It's best to eat less red meat. Instead, have more poultry and seafood, and limit that to 6 ounces or less per day. Choose grilled or baked protein instead of fried. Have fewer processed foods, particularly ones with hidden phosphorus. Reduce sodium intake. The recommendation is 1,500 to 2,300 milligrams a day of salt. Limit alcohol consumption. and adjust calorie intake to reach a healthy weight. For people that have chronic kidney disease in stage 3 or stage 4, they may still feel completely normal, or they could start to notice the following symptoms: being very tired or fatigued, obvious swelling in their hands or feet and ankles and around their eyes, a dull and constant backache, like in their midsection of their back, changes in their appetite or eating pattern. They may have changes in urination, such as amount, color, and frequency. They may also have symptoms from high blood pressure, such as headaches, blurred vision, shortness of breath, and dizziness. They may experience nausea, vomiting, bloating, and slow digestion. It is recommended for someone with chronic kidney disease stage 3 to meet with a dietitian and ask their doctor for a copy of the recommended diet. Some things to avoid are high phosphorus foods. These include all dairy products, dried beans and lentils, processed meats, chocolate, cola, beer, muffins, biscuits, or pancakes from mix, liver or organ meats, nuts, and seeds. Avoid saturated fats that are found in animal products such as butter, cream, whole milk, cheese, ice cream, and fatty meats. Avoid oils such as palm and some types of vegetable oil and coconut oil. Have a low sodium diet. And it's good to include some water-soluble vitamins, but ask the doctor what's recommended so you have the right amount and not too much vitamin C. When someone has chronic kidney disease stage 4, their kidneys are not efficiently cleaning waste products. As kidney function decreases, waste isn't removed from the body efficiently and can build up in the blood. Vitamins and minerals are not absorbed well from food. The bones start to weaken. Calcifications in the heart, blood vessels, and other soft tissues start to happen. When someone has chronic kidney disease and they're in stage 4, tracking their weekly weight is important to see if more calories are needed. Coordination with a dietitian is needed to help with setting realistic weight goals, depending on their current weight. A fluid restriction diet may be prescribed. Signs of fluid retention include swelling in the feet, hands, and face, sudden weight gain, shortness of breath, and high blood pressure. They also might be prescribed a diet that's lower in protein. Chronic kidney disease stage 5. This is also known as end-stage kidney disease, and it's the last stage of chronic kidney disease. At this point, the kidneys are working below 10% of their normal function, and they can no longer support a person's day-to-day life. There's decrease in how much a person can urinate or an inability to urinate. There's fatigue or a general ill feeling, unexplained weight loss, loss of appetite, nausea and vomiting, dry skin and itching, changes in skin color, bone pain, confusion, difficulty concentrating, and difficulty in breathing may occur. Diet plays an important role in the management of kidney failure because foods and beverages contain electrolytes and nutrients that must be kept in balance by the kidneys. The diet for kidney failure patients may involve restricting fluids, sodium, potassium, phosphorus, and protein. It is best the person follows their doctor's orders for their special diet. Dialysis is the treatment for chronic kidney disease stage 5, and this involves the clinical purification of blood by removing waste and fluid as a substitute for the normal function of the kidney. Dialysis is needed when 80 to 95% of the kidneys are no longer functioning. There are 2 types of dialysis: hemodialysis, a machine type, and peritoneal dialysis, which is the individual's natural abdominal filtering ability. Dialysis is not a cure for kidney disease, and it will continue to be needed until a kidney transplant is done. This slide is showing the 2 different types of dialysis. On the left is the machine type known as hemodialysis, and it is usually done 3 times a week for 3 to 4 hours a day, depending on how well a patient's kidneys are working and how much fluid weight they have gained between treatments. On the right is peritoneal dialysis, which is done at home. There's 2 different types of this. There's continuous ambulatory peritoneal dialysis, where a person or a caregiver can change the solution bag, and the solution contains a cleansing fluid, and it flows through a tube known as a catheter into part of the abdomen, and it filters waste products from the blood. There's also a machine that can be used at home that basically does the same type of thing, and this is usually done overnight with the machine. And if a person does it themselves, they may change the bag at periods of time throughout the day, several times. There is a Medicare benefit for someone that has end-stage renal disease, and this is when they have permanent kidney failure that requires dialysis or a kidney transplant, or when they themselves or their spouse or their parent has enough Medicare work history to qualify for Social Security. And the person does not have to be 65 years of age to qualify for this benefit. Liver disease. The following slides will discuss the process of liver disease. The liver is an organ about the size of a football. It is located under the rib cage on the right side of your abdomen. It is essential for digesting food by releasing and storing glucose. The liver clears the blood of drugs and other harmful substances. With the help of vitamin K, the liver produces proteins that are important in blood clotting. The liver breaks down old or damaged blood cells. It also plays a central role in all metabolic processes in the body. In fat metabolism, the liver cells break down fats and produce energy. Liver disease causes: genetics, viruses such as hepatitis A, B, and C, autoimmune hepatitis, cirrhosis, and cancer. Risk factors are alcohol use, IV drug use, because that could contribute to having hepatitis and a dirty needle if someone's sharing needles. Diabetes as a risk factor, obesity, tattoos due to possibility of being exposed to dirty needles that have the hepatitis virus, and unprotected sex because bodily fluids may have the hepatitis virus also. Exposure to chemicals and toxins, high level of triglycerides, and over time, damage to the liver results in scarring, which can lead to liver failure. Some of the signs and symptoms of liver disease are the skin and eyes that appear yellow, also known as jaundice, abdominal pain and swelling, swelling in the legs and ankles, having itchy skin, having urine that's dark in color, a pale dark stool or bloody or tar-colored stools, chronic fatigue, nausea or vomiting, loss of appetite, and having the tendency to bruise easily. Liver disease can be diagnosed by having some blood tests done called liver function test. There are also blood tests that can be done to look for specific liver problems or genetic conditions. There are also imaging tests such as a CT scan, an MRI, and ultrasound that can show liver damage. There's also tissue analysis, such as a biopsy by removing a little sample of tissue from the liver to diagnose liver disease. Lifestyle modifications that'll keep your liver healthy include avoiding alcohol and nicotine, eating a balanced diet that's low in salt, avoiding raw seafood, and losing weight. Treatment for liver disease depends on the diagnosis. Currently, about 17,000 adults and children have been medically approved for a liver transplant, and they are waiting for donated livers to become available. The waiting list grows every year. In the early stage of any liver disease, the liver may become inflamed, tender, and enlarged. Inflammation is a sign that the body is trying to fight an infection or heal an injury. If the inflammation continues over time, it can start to hurt the liver permanently. An inflamed liver may cause no symptoms. If liver disease is diagnosed and treated successfully at this stage, the inflammation may go away. If left untreated, the inflamed liver will start to scar. Fibrosis is excess scar tissue growth replacing healthy liver tissue. Scar tissue can keep blood from flowing through the liver. The healthy part of the liver has to work harder to make up for the scarred part. If liver disease is diagnosed and treated successfully at this stage, there's still a chance it can heal itself over time. Cirrhosis can lead to a number of complications, including liver cancer. During this stage of liver disease, the liver is no longer able to repair itself. For some people, the symptoms of cirrhosis may be the first signs of liver disease. Bleeding or bruising easily is one of the symptoms. Water may build up in the legs and/or their abdomen. The skin and eyes may take on a yellow color. Their skin may be itchy, very intensely itchy. Blood vessels leading to the liver may burst. Sensitivity to medications and their side effects may increase. Insulin resistance and type 2 diabetes risk increases. Toxins may build up in the brain. There could be problems with concentration, memory, sleeping, or other mental functions may happen. Liver failure means that the liver is losing or has lost all of its function. It is a life-threatening condition that demands urgent medical care. The first symptoms of liver failure are often nausea, fatigue, diarrhea, and loss of appetite. It is best for someone with these symptoms to seek medical care with their primary care physician or the urgent care. As liver failure progresses, the symptoms become more serious. A person may have confusion and disorientation. They may feel extremely sleepy. There is a risk of coma and death. Immediate treatment is needed. The only option may be a liver transplant. Acute liver failure is an uncommon condition in which liver function rapidly deteriorates. Liver failure can occur suddenly in as little as 48 hours. It is usually a reaction to poisoning or a medication overdose such as Tylenol, risperidone, or birth control pills. Our liver breaks down medication, and this is why this can happen quickly. Acute liver failure is a medical emergency. Alcohol can damage or destroy liver cells. The liver breaks down alcohol so it can be removed from your body. Your liver can become injured or seriously damaged if you drink more alcohol than it can process. There are three main types of alcohol-related liver disease: alcoholic fatty liver disease, alcoholic hepatitis, and alcoholic cirrhosis. Fatty liver disease is the earliest stage of alcohol-related liver disease. There are usually no symptoms. If symptoms do occur, they may include fatigue, weakness, and discomfort localized to the right upper abdomen area. Liver enzymes may be elevated, however tests of liver function are often normal. Many heavy drinkers have fatty liver disease. Alcoholic fatty liver disease may be reversible with abstinence of alcohol. Alcoholic hepatitis is characterized by fat deposits in liver cells, inflammation, and mild scarring of the liver. Symptoms may include loss of appetite, nausea, vomiting, abdominal pain, fever, and jaundice. Liver enzymes are elevated and tests of liver function may be abnormal. Up to 35% of heavy drinkers develop alcoholic hepatitis, and of these, 55% already have cirrhosis. Alcoholic hepatitis can be mild or severe. Mild alcoholic hepatitis may be reversed with abstinence. Severe alcoholic hepatitis may occur suddenly and lead to serious complications, including liver failure and death. Alcoholic-induced cirrhosis, the most advanced type of alcohol-induced liver injury, is characterized by severe scarring and disruption of the normal structure of the liver. Hard scar tissue replaces soft, healthy tissue. Between 10 and 20% of heavy drinkers develop cirrhosis. Cirrhosis is the most advanced type of alcohol-related liver disease and is not reversed with abstinence. Cirrhosis can lead to liver failure. Complications from alcohol-related liver disease usually occur after many years of heavy drinking. They may include liver-related conditions that are a consequence of the disease, such as buildup of fluid in the abdomen, bleeding from veins in the esophagus or stomach, enlarged spleen, brain disorders and coma, kidney failure, and liver cancer. Non-alcoholic fatty liver disease is the buildup of extra fat in liver cells that is not caused by alcohol. It is diagnosed when more than 5 to 10% of the liver's weight is fat. Risk factors include being overweight, having the diagnosis of diabetes, having high cholesterol or high triglycerides, losing weight rapidly, and some people develop non-alcoholic fatty liver disease even if they do not have any risk factors. This disease affects up to 25% of people in the United States. It is a leading cause of chronic liver disease in children and in adults in the United States. It's the third most common reason for a liver transplant in the United States. Many people do not have symptoms of non-alcoholic fatty liver disease. Liver function tests often show high enzyme levels, and non-alcoholic fatty liver disease is suspected. Often, an ultrasound is used to diagnose this condition. Non-alcoholic steatohepatitis, also known as NASH. This is a more severe form of non-alcoholic fatty liver disease. NASH causes the liver to swell and become damaged. NASH is one of the leading causes of cirrhosis in the United States. Up to 25% of adults with NASH may have cirrhosis. NASH often has no symptoms and or can take years for symptoms to appear. NASH risk factors are being overweight or obese, having diabetes, having high cholesterol or high triglycerides, and most people with NASH are between the ages of 40 and 60 years old, and it's more common in women than in men. The diagnosis of NASH may be confirmed with a right upper quadrant ultrasound examination. If liver blood tests are very elevated, or if there are other signs of liver disease, then a liver biopsy may be recommended. There are no medical treatments yet for non-alcoholic fatty liver disease. However, lifestyle changes can help. By losing weight, and if you're overweight or obese, continue to keep working at losing weight, lower cholesterol and triglycerides, control diabetes, and avoid alcohol. And it's best to be monitored by a liver specialist. The liver and kidneys perform vital functions in the body because they are responsible for filtration, absorption of nutrients, waste elimination, and contribute to digestion. To keep the kidneys and liver healthy, avoid obesity and weight gain, don't consume excess salt, avoid excess alcohol consumption, consume adequate high-quality protein in your diet such as eggs, milk, fish, and yogurt. Add antioxidants to your diet such as broccoli, kale, cauliflower, and collard greens. Garlic, grapefruit, green tea, and green vegetables are all foods known to help keep the liver healthy. More ways to keep the kidneys and liver healthy. Red bell peppers, cabbage, cauliflower, garlic, onions, apples, and raw fruits are good for the kidneys. Drinking plenty of water and exercising regularly. Prevent kidney stones by getting plenty of magnesium in your diet. Just follow what your doctor recommends. Take pain medications as directed by your doctor, including aspirin, ibuprofen, and Tylenol. Control blood pressure. Keep a current list of medications updated. Know what medications can harm the liver and kidneys, and use the same pharmacy to fill medications, as the pharmacist will be aware of interactions of your medications. Some IPOS school examples for kidney and liver disease would be for medical or behavioral health management. Individual will follow the doctor-approved recommended diet, and/or the individual will attend all medical appointments. For role management or modifying behaviors, the individual will learn how to make healthier foods and/or will attend AA or NA meetings to refrain from alcohol use and illicit drug use. And for emotional management or healthy coping skills, an example would be an individual will ask questions about their disease and seek out resources and seek support if needed. Kidney and liver disease quiz. Number 1, kidneys are vital organs and filter waste products from the blood. True or false? Number 2, cirrhosis can lead to a number of complications, including liver cancer. True or false? Number 3, the liver sits on the right side of your body. True or false? Number 4, blood pressure is not a risk factor for kidney disease. True or false? Number 5, a person can live with one healthy kidney. True or false? Here are the answers to the quiz. Number 1, the kidneys are vital organs and filter waste products from the blood. This is true. Number 2, cirrhosis can lead to a number of complications, including liver cancer. This is true. Number 3, the liver sits on the right side of your abdomen. This is true. Number 4, blood pressure is not a risk factor for kidney disease. This is false, because blood pressure is a risk factor for kidney disease. Number 5, a person can live with one healthy kidney. This is true. Remember to teach other people about the website My Strength, and this is for all the individuals we serve, as well as all case managers and anyone who would like to join. This has a lot of resources on mental health, and it provides a lot of support resources. The website's noted at the bottom there, www.mystrength.com. Resources used for this PowerPoint were American Kidney Fund, the National Kidney Foundation, DaVita Dialysis Center, American Liver Foundation, and Johns Hopkins Medicine. This concludes our presentation on the liver and the kidneys. We hope this was helpful for you as you move forward to assist others. If there are any additional questions or concerns, please feel free to contact Susan Stevens or Nicole Brown at the following email addresses and phone numbers. And thank you so much for watching.